President Cyril Ramaphosa has placed Health Minister Dr. Zweli Mkhize on special leave. Pressure, of course, has been mounting on Mkhize to resign after he was implicated in an irregular multi-million rand contract. The Auditor General's report found irregularities in the awarding of the media contract to Digital Vibes. The Special Investigating Unit is currently probing that contract. Mkhize has denied any wrongdoing, saying he did not personally benefit from the deal. The President says the special leave will allow Mkhize to deal with the allegations and investigations. Tourism Minister Mmamoloko Kubayi-Ngubane has been appointed as the acting Health Minister. eNCA reporter Heidi Jarkos is in the Northern Cape. She's been following that story for us, and she joins us from Kimberley. Hi there, Heidi. So, of course, you were following the Health Minister as he made a visit to the Northern Cape today. He didn't announce that he was going on to special leave, but he certainly alluded to it in that press conference you attended. Just tell us a little bit more about exactly what he said earlier.
Yes, certainly, Sally. I think the writing was most certainly on the wall when it came to the future of the Health Minister with regards to the next steps that were going to be taken. Many people were calling and questioning why the President had not taken any action, or why the President had not put the Health Minister on special leave, given the allegations levelled against the Health Ministry and Dr. Zweli Mkhize himself. But initially, when we saw him at this briefing today, it was more for a vaccination site inspection, and then at the end of the briefing he decided to say a few words, that he unreservedly apologises, and when eNCA probed and pushed further with regards to the next steps that the Minister is going to take and whether or not he believes he should actually step aside pending the investigation and the report by the SIU, he said that no conversation was had with regards to any kind of resignation, but rather special leave. So it seems as though the Minister himself had probably suggested that he should go on special leave, and that was the discussion that he had with the President. Zweli Mkhize also added that he had been in constant communication with the President regarding the matter and the investigations that were ongoing and the many concerns that South Africans were raising, and of course that investigation that was brought out about his alleged direct involvement with Digital Vibes. But let's listen to what the Minister said with regards to special leave and resignation.
But we have not discussed the issue of resignation. We have discussed with the President the issue of a special leave pending the report of the SIU. So in this case, you would recall that if we talk about issues of step aside, we're dealing here with a situation which usually you are dealing with where there have been a report that indicates particular issues that need to be answered. I think that report must be awaited, and I think from my point of view, we'll continue to cooperate with the process. And therefore, what we have discussed has been on the issue of the special leave with the President.
And of course, Heidi, that was a little earlier in the day, and then just after 3 o'clock, the Presidency broke the news that the Health Minister was actually going to be placed, or was being placed, on special leave. Am I correct that the Health Minister was long gone from that media briefing by the time your team received the news?
Yes, indeed, Sally, but now that my cameraman and I think back to the events leading up to him actually leaving one of the vaccination sites, it seemed quite rushed, and we do know that he was supposed to go to 2 vaccination sites to do an inspection, and he only ended up going to 1 vaccination site, and it seemed as though it was quite a rushed process, and we were unsure as to why it was last minute that he would not be going to the last vaccination site on the program. But I had an opportunity to ask him questions again there and say to him, is there a time frame? Has the President had a discussion with you as to when he could possibly put you on special leave pending these investigations and your alleged involvement with Digital Vibes and this contract that has been awarded to your close associates? Whereas the Minister said that the information is on the President's desk and it's up to him to make a decision. And literally an hour after that, the President sent out that statement to say he has been put on special leave, and the Minister of Tourism, Mmamoloko Kubayi-Ngubane, will be acting as the Health Minister. But of course, the Health Minister, Dr. Zweli Mkhize, is saying that he would like to apologize to South Africans for the scandal that has been brought about by Digital Vibes. He says he has been affected, his family has been affected, and he believes that the scandal that has been brought about by Digital Vibes and his alleged involvement has impacted the good work and the efforts that are being done to curb the spread of COVID-19 and to procure vaccines. So let's just listen to what the Minister said in the beginning of his press briefing about how sorry he is.
He's saying that I fully acknowledge and take personal responsibility for the public outrage that has been caused by this Digital Vibe contract. I want to state it upfront that I do not in any way undermine the voices, the views, the disappointment, the anger and the calls for accountability that have been made by the citizens. The negative discourse has not only had impact on me, but it has also had impact on my family. But most of all, also it has tainted the teamwork of our government that is led by President in our continued efforts to fight COVID-19 situation. It's also caused a bit of disruption, and so for all of this I want to unreservedly apologize. It has been a very difficult matter to deal with. Nevertheless, I should also just explain that following the decision to write to the SIU and inform them of what we had uncovered as family, I received legal advice that it would be prudent for me to focus on getting that information or discussing those issues with any evidence and fully cooperate with the SIU process, instead therefore of focusing largely on responding to the public. So you might therefore find that there were many queries that were not responded to, but it was not really because we wanted to dodge those queries. It was more because the focus had to be about dealing with this particular issue.
All right, so he's apologizing there, Heidi, for the enormous disruption this has caused, but being very careful, not in any way taking on any culpability, as it were. And he's maintained all along, he said he's never benefited personally, but of course the reporting by Peter Louis Myburgh of the Daily Maverick has uncovered more and more sort of worrisome accounts of how it seems his family may have personally benefited from this Digital Vibes contract. So Heidi, the Minister now is on special leave. The Tourism Minister becomes the acting Health Minister. But let's not forget that you're all there in the Northern Cape to follow the Minister, but also to focus on what is happening in this province that has been severely impacted by its third wave. Just update us on where the Northern Cape is and the challenges they are facing due to the pandemic.
Certainly, Sally, and I think this is extremely key given the fact that the Northern Cape is currently in its third wave. The Minister has, of course, confirmed this today, saying that the cases are increasing daily and it's becoming worrying. But what's interesting here and also quite concerning is that this province, specifically the Northern Cape, because many areas are remote and rural areas, this province, the vaccination sites were built to accommodate the Johnson & Johnson vaccine. And because that has been delayed and has not been released from the Eastern Cape, the Premier, the MEC and health officials in the province have now needed to try and find alternative ways to accommodate and administer the Pfizer vaccine, as it's the only vaccine that can be administered in the country at the moment. So that was a big highlight to say that we need the Johnson & Johnson vaccine specifically in the Northern Cape because of the storage facilities and because of vaccination sites not having the capacity to administer Pfizer. We were actually at one of the vaccination sites after the Minister left, and you can see some of the challenges. Not many vaccinators, not many vaccines, and of course they are trying to get people to adhere to the regulations and rules, social distancing, mask wearing, sanitizing, washing of hands, and they do believe that during the Easter period, that seems to have dipped a little bit, and that's why there's been an uptick in numbers. They are trying. We do understand the last 7 days the numbers have dropped significantly. It's not so alarming anymore. But of course, the Premier and the MEC in the province saying that nobody should let their guard down and everybody should take precaution, and the risk is still out there, even though people are being vaccinated. So we'll do an in-depth look in the next couple of days as to what is actually going on at the vaccination sites and what are some of the other challenges. And hopefully, Sally, will get those Johnson & Johnson vaccines so they can start administering that vaccine here in the Northern Cape.
Well, thank you so much for your reporting. That's eNCA reporter Hadi Jokas coming to us live from Kimberley today.